Hey guys, so this TED Talk is called Healthcare Should Be a Team Sport, and the TED Talk suggests that we need to reinvent our healthcare system and focus on a personal healthcare system that includes new technologies and new roles. So Eric, the presenter, starts off by talking about his experience of being diagnosed with a terminal kidney disease, and he talks about his specific experiences in working with his specific healthcare team during that diagnosis. So he believes that we're working in a flawed system and an expensive system that's set up the wrong way. So he proposes that we invent a new healthcare system that is a personal healthcare system, and he discusses three pillars that he believes we need to incorporate to create the best healthcare system that we possibly can. So the three pillars that he talks about are care anywhere, care networking, and care customization. So first he starts talking about care anywhere. So he states that hospitals and clinics are just a thing of the past, like they're outdated. We've been using them since the 1700s. He believes that patients shouldn't have to travel to these places for all of their care, especially primary care. Transportation and other aspects of our healthcare system right now are very expensive, and sometimes it's just not possible for people to get to their appointments and things like that. So he also talks about how going to doctor's office clinics and hospitals can also be unsafe for sick patients because of the exposure to all the germs that are there. So he believes the future of a personal healthcare system must start at home as the default model. So he talks about using technology such as iPads and iPhones, and having systems where we can set up to be able to monitor vital signs at home, do lab work at home, and things like that. And therefore, the individuals will only have to go to the hospital if they're actually sick enough where they need to be there. So with the technology getting more and more advanced every day, he believes that soon these options will be available for everyone. The second pillar that he discusses is care networking. And he states that we need to use multidisciplinary teams approach in providing patient care instead of just going to an isolated specialist. A lot of error, about 80% of errors occur because of issues with communication and coordination among members of the healthcare team. So in specific, he gives two examples of how he was being worked up for a serious cardiac issue that he was having after he was diagnosed, and he comes to find out that he was actually just prescribed 3 of the same medications and no one had ever noticed the mistake. So he wants to use technology to make healthcare a coordinated team sport, which I think is great. The third pillar that he discusses is care customization. So he discusses how healthcare right now is treating people as averages instead of unique individuals. So he states that technology is coming along, and it will allow us to build predictive models for each individual patient. And he shares 2 examples of goals that he personally has in relation to living a healthy life, and he's asked his medical teams to take these goals into consideration when creating his unique healthcare plan. So these 3 pillars he talks about are all kind of happening now in pieces, but there's just a lot of room for improvements in individuals taking care of in control of their own personal health. So the 2 discussion questions that I came up with, the first one is Eric talks about the fact that 80% of medical errors are actually caused by communication and coordination problems amongst the members of the healthcare team. So what are some ways that we can improve on communication and coordination as being members of the healthcare team? And my second discussion question is, Eric's idea about care anywhere is something that's completely new, a completely new concept to us in our healthcare system. As a society, we are so used to physically going to clinics, going to our doctor's appointments, going to the hospitals when we're sick. And it's how it's been for ages. So what do you believe are some pros and cons to his model of an at-home healthcare system? All right, thanks.